Hey, YouTubers. I'm in my bedroom right now, my parents' house in Massachusetts. Be so damn cold here, damn hot here, damn. Anyway, today is Medical Thursday right now. So, yes, Medical Thursday right now, like the big ass cigar. So, obviously not a doctor for the last damn time. So, I am not a doctor for the last damn time. And that's my disclaimer. Also, my disclaimer is I'm not a patient, nor am I a survivor myself. So, those are my disclaimers, my damn disclaimers. Anyway, so this topic right now, we're focusing right now, is going to be about hospice care and quitting tobacco. So you have hospice care and quitting tobacco. Now, what is hospice care? What the hell is this? Now, hospice care is basically end-of-life care. So when somebody is admitted to hospice or a hospital for end-of-life care. So somebody might have lung cancer, they might have emphysema, they might have pancreatic cancer, liver cancer, colorectal cancer, really any type of cancer or any type of terminal disease. And basically they have made the decision not to proceed with treatment, meaning no more chemotherapy, no more radiation, no more, any kind of treatment, freaking treatment, and basically they're approaching the end of life, and hospice care is basically palliative care for end-of-life care. Now, it's very important if you are admitted to hospice care, this is my personal opinion, like my asshole, obviously I'm not a doctor, damn doctor, it's very important to quit smoking tobacco or quit using tobacco, because honestly, even though your illness is terminal, which means you cannot be cured and you are most likely going to die of it. You might not die tomorrow, you might not die a week from today, or even a month from today, but your illness is terminal. Generally, people who are in hospice have 6 months or less to live, somewhere in that ballpark. So it's very important to quit using tobacco, quit smoking, because essentially your quality of life will improve. I'm not a damn doctor, but your quality of life will definitely improve. If, for example, you have lung cancer, which a lot of people in hospice care have lung cancer from smoking cigarettes for many years, your quality of life will improve. Yes, it may be terminal. Yes, that may suck in general. It does suck in general, totally fucking suck in general that your lung cancer is terminal and essentially you are going to die from it. But the remainder of your life, whether it's 3 months, 6 months, a year, 18 months, etc., the quality of your life will improve. Your breathing will improve, even though you have terminal lung cancer, even though it may be very painful. And obviously hospice care, sorry, my nose was just itchy. They're very good at administering pain medication, pain pills, pain infusion, etc. So they will control your pain while in hospice. But quitting smoking will definitely improve your overall life your life experience. The remainder of your life will be a lot better compared to if you continue to smoke. See, if you continue to smoke or continue to use tobacco products, in the case of like chewing tobacco, dipping tobacco for like terminal mouth cancer, terminal throat cancer, the quality of your life will go downhill because you will continue to have severe breathing problems. I'm not saying you won't have breathing problems with terminal lung cancer, but the less you smoke, or if you don't smoke at all and you quit smoking when you're admitted to hospice, you will notice differences in your breathing will improve a little bit. At least. So there are still benefits. Like they say, it's never too late to quit smoking. It's never too late to give up, tobacco. Even if you are terminal and, your life is going to end, relatively soon, in the next 6 months to a year, there are always still benefits to stopping using the product because your quality of life will improve if you stop using the product. And also keep in mind something very damn important is a lot of hospice care facilities don't allow smoking on the property or tobacco use on the property. Actually, the vast majority of hospitals nowadays in 2022 going into 2023 are completely smoke-free. They are completely tobacco-free. Not only do they not allow smoking on the property, they don't even allow like chewing tobacco on the property, like dipping tobacco on the property, or snus or snuff or vaping. So that's the thing is, a lot of facilities, there are long-term care facilities, they may very well not allow any smoking in the property, and obviously you don't want to get like evicted from the facility because you're caught smoking. So that's something to keep in mind, that a lot of these facilities are completely tobacco-free and do not allow any smoking on the property. I know of a hospital where, yes, you could smoke, but you would need a written note from your doctor. Not going to mention the name of the hospital, not going to dox a hospital, but essentially you need a written note from your doctor, and they have designated smoking shelters. So the whole freaking point is, if you're so sick that you're essentially terminal and you're gonna die of, cancer pretty soon, dude, it's really time to give up smoking. It's really time to give up fucking smoking. It's like, you've had your run, you've had your fun. It's time to give up smoking. It's like, are you really going to smoke out in the rain while you're dying of lung cancer? I mean, hell no. It's like, you've already given yourself most likely cancer by smoking, by choosing to smoke for 20 or 30 years, and now you're going to continue to smoke even though you're probably coughing up blood or you're probably having, severe health issues. It's like, dude, it's time to give up smoking. Nobody can force you. Hypothetically, if your hospice care facility allows smoking somewhere on the property in a designated area outside, that's your choice. Nobody can force you. Unless you're living in a facility where it strictly prohibits smoking, which a lot of these facilities do prohibit smoking, but nobody can force you. It's like, and some people may want to die at their own house. They may want to stay at their own house and pass away there, and that's their choice. But honestly, if you have terminal cancer and you're going to long-term palliative or hospice care, it's really time to quit smoking. I understand it's hard. I understand giving up smoking is hard. It's fucking hard, but there are ways to help you. There's the patch, the gum, the inhaler, the lozenges. There's, for chewing tobacco, there's like tobacco replacement, like mint snuff, or like coffee mint snuff, which is basically non-tobacco, non-nicotine snuff. There are ways to help you. If you're dying of cancer, it's really time to stop smoking. I keep repeating myself, but it's really time to stop fucking smoking. Anyway, I'll step off my soapbox. Have a nice day. Bye-bye.